day. It's not even noon, and we're starting to fill up. I see very familiar faces. This is Leo, Sarkissian with the Ark, waving.
Hey, Leo.
Hi, how you doing? And it's great to see Bill Gaventa's on already, and Anne Fract is with us. You might know her, Bill. She's been active for years with Sabi, and our star from our national video, Giassi, is on, I see, and Alice Taylor and others. So great, Lee. Good. Wow. So it starts to fill up a few minutes, and good to see everybody. I can't believe it's the end of April. I don't know if, I just can't even believe it. It's the end of April after the year we've had, right? A few months. So Carrie Mahoney will be managing this as usual, and she will be, looking at your chat questions. And I got a feeling we're going to run a little over today because we've got someone with us who's got so much to talk about. In fact, he kidded me. Bill Gaventa had kidded me, and I'm going to introduce him later, a couple of minutes after we get started, about how he had about 4 hours of stuff and answer to my questions. So, and normally, he's somebody who founded the Faith Collaborative and People with Disabilities and Faith, and he's been around for a long time. So it's really a pleasure to have him here with us. And I didn't realize he'd moved from the East Coast, where he had been to Austin, Texas. So
yeah, we've got son and daughter-in-law and grandson here, so that's pretty attractive.
That makes sense. And I hear such great things about Austin. I've never visited it, but I've been wanting to. But yeah, I would say grandchildren really play a big role. It's right and moves. It's funny how that works, right?
Yep.
I feel like I moved from, my parents actually moved up here near me, but historically we would go to my parents. Nowadays, it's like both ways. You go to your parents in our generation and then go to our kids, it seems like. So.
Well, I will try not to keep everybody too long, but I may go fast, and people will be welcome to contact me later. But I'm a clergyman. I'm a preacher. We tend to go on sometimes.
And I'm excited. I haven't seen it. I planned to see it this weekend. There was a seminar on an hour, I think, webinar Thursday. That was right at the same time as another meeting, but I have it, the link saved, and I'm going to go up and check out the webinar this week. So I'm looking forward to that.
Yeah, that's on the PowerPoint. So on this PowerPoint, so other people can go check it out too. So
good.
Can you hear me? Can I ask if you can hear me?
Yes,
yeah, I can.
You're on.
Okay. Good. Well, I do have to say my name is Linda Davis, and when you said clergy, my daughter and I spent 12 years in South Carolina with God growing us down there, and then he sent us back to New England, and I'm like, really, God? New England? From the Bible Belt to not the Bible Belt? And I actually did run a ministry solo down there for young adults with disabilities. That was a God thing. So
great.
I have a daughter with a disability. You just saw her come in trying to make the screen bigger. So I wonder who's the one with the disability, me or her? I'm not sure.
Well, I think it's great to have you with us and really appreciate it and the work you're doing. That's awesome, Linda.
Yeah.
Thank you. Well, I now live in Haverhill, and we are connected with Granite United here. And I'm still trying to figure out why I'm here. I have a son and daughter-in-law that are in Germany in the Air Force with my grandbaby. And I'm from a family of non-believers, so I'm figuring this is a mission field up here, why he brought us here. So
there are a lot of good people up in Massachusetts that I know from different faith communities. So yeah.
Absolutely. Yeah.
So it is 12 o'clock, so Carrie doesn't have to push me to start today. And I'm really happy to be with you. So let me get going. So, and some of you may want to mute for a while until question and answer time. Just going to give you every week what I try to do. I'm going to be not as much on the key issues this week because we have a wonderful guest with us. But I want to kick in to the presentation. I think, am I sharing it also, Carrie? So oh yeah, thank you, Carrie. So here's an update on what's going on this week. Always start with a little bit of depressing data. I think this data doesn't look all that bad in the sense that it feels to me like it's slowing. We're getting much more testing done. So there's almost 55,000 people who got COVID that we know of, right? By the way, because everyone's not getting tested. there's close to 3,000 deaths, not quite 2,900, 2,899 deaths as of today. And as of yesterday, actually, that's when I got the update from the command center. And that is, even though a little bit of a bigger bump than last week from a question of like geometrics and multiples, that also seems to be slowing down, and hopefully it is. And that's obviously the clearest information we get, unfortunately, is that sad data in the morning, people who we have lost over the past weeks through this virus. And finally, we have 236,000 people tested. So that is the nicest jump to see, to be quite honest with you. So we're trying to get a handle on it. There's mobile testing now going on for small homes in the community, and it was expanded to folks that are funded through Department of Mental Health last week as well. And I'm sure the places where there's kids live in teens and homes, group settings as well. And it started with the Department of Developmental Services on the previous weekend. So what I'd like to do is just touch on, we always do a review of the key issues. Still working on equity in healthcare. At Mass General Hospital announced it would allow for pediatrics for sure people in, and then on a case-by-case basis for adults with disabilities, and the head nurse on that unit. So what you guys may know, in addition to working with CPR and other organizations on the legal side of this, we have developed a page, an awareness page with videos and pictures. And the whole point is for doctors on triage teams or people that are in units to take a look at it and be a little more aware. And it's less than 15 minutes. So we're not asking people for a ton of time from their busy schedules of healthcare providers. And then we're still continuing to work on these other issues, further financial support for residential, additional assistance for individuals and families at home, addressing special education, retainer funding for employment services, and nationally for home and community-based services, 15% bump for that, and more help for caregivers. And we still need protective equipment, no question about it. So together, we can make these things happen. And I appreciate what the governor and Mary Lou Sutters and Dan Tsai and the others in government have been doing, and as well as the legislature, the wonderful support from our state legislature. So thank Massachusetts, we're getting there. We've gotten a lot of good support already. We're working to get more. So let's go on. And our main feature today, which I wanted to rush to, is Bill Gaventa. Bill is a national consultant, a trainer, speaker, and author. He has a recent book at Baylor University Press, and I'm looking forward to reading it, Disability and Spirituality, Recovering Wholeness. He was the coordinated community and congregational supports at the Bog Center. He was program director of that until 2013. And for 16 years, he oversaw the association newsletter, AAIDD, which is the professional body in our space for the religion and spirituality division. He's the founder of the Institute on Theology and Disability, and he's a co-founder or founder of the Collaborative on Faith and Disability, which I really encourage you to check out, faithanddisability.org. He's somebody who's really motivated, influenced, driven, the thinking of the fact that faith and spirituality is a part of all of us. It's part of that equity, right, that we talk about. It's not just about healthcare or education. It is about spirituality and faith and the stuff that helps us grow as full human beings. So without any further ado, I asked Bill to come to talk about loss, talk about grief, but loss is many things. And I don't want to just think loss in terms of dying, but the loss, of course, people are experiencing in other ways. And he he's going to do in an abbreviated form what he would do in a longer form, but I'm really looking forward to his participating with us today. And Carrie will be guiding you through this as well. Carrie Mahoney, our Director of Education and Outreach on the chat end of it. So Bill, without further ado, welcome, really psyched. And there was that magazine, by the way, which you might remember, and I can't believe I can't think of the name. It was a booklet, Weavings, something like that.
Yeah.
And that was an awesome publication, as well as what you would put out in the newsletter. And I feel like I might have read you first in there years ago.
I don't remember weavings, but anyway, I used to also, for a while, did a column for the National Arc newspaper before they
There
changed
you
the
go.
format. Yeah,
That's
that,
it.
that
That's
was a lot of
probably it.
fun.
Yes, and I used to see you speak. So yeah, well, welcome.
That was
Welcome
a lot
to
of fun. Well, thanks. It's a really honor to. Can you hear me all right?
Yes.
Yeah. And Carrie, are you going to advance, or you want me to advance?
Carrie, you got to unmute yourself to tell him or chat him. She's advancing for me, so I think you're good.
Okay. All right. Good. Okay. All right. Well, this is a time of really a lot of anxiety and a lot of fear and a lot of loss, certainly of daily routines and things we usually do. You know, our lives have been kind of turned upside down. And I think one of the reasons it's really particularly, go back one, please, Carrie. It is challenging to people who work in the area of intellectual and developmental disabilities is the key values that we talk about in that arena all the time are independence, productivity, inclusion, self-determination. You know, all those are many values in many of our agency mission statements. And each one of those things that people usually do to work on those, learning more skills in those areas, are pretty challenged in this time. You know, we've become much more dependent, and in good ways, I think we learn about how interdependent we are on everybody. But I think families and people who worked in the area of disability have known that for a long time. I think it's known, and so in some ways, I think right now what people in the world of disabilities can say to the rest of the world is, "Welcome to our world." You recognize how completely interdependent and we are on care and love and relationships and things that matter, particularly maybe more than how much money somebody's making. But inclusion has been cut off. Lots of families can't see their loved ones who are in residential programs of one kind or another. Self-determination, you know, when you're sitting around a home all day or a residential place, it's kind of, you know, for most of us these days, we don't get to make a lot of choices or feel like we don't. But even more, you know, even below at the base of all that is kind of basic health and safety. And lots of families have been very worried, of course, about the safety of their children or grown adults, and the fact that what would happen to them if they go into a hospital, and especially if they're somebody who can't communicate very well. I just saw the news yesterday that New Jersey has come out with a policy that says families and caregivers can legally visit people with intellectual and developmental disabilities in hospitals in New Jersey. So there's some people who've been working on that policy at a state level. Next slide, please.
You know, I made you co-host, Bill.
Okay,
so,
okay.
You may be able to change the slides yourself. Just
All right.
We can. Okay.
I'll try it on the next one. Okay. All right.
Great.
And I think for any kind of loss, especially around death and end of life issues in intellectual disabilities, I think lots of feelings go on. I've had, you know, I've done a lot of training with direct care providers, direct support professionals in New Jersey around loss and grief. And numbers of them would often say, it just seems like, you know, it's unfair. If people have a disability, why should they have to deal with death as well? Like it's kind of a double injustice. And you add the virus into this mixture, you know, it seems like people maybe who have gotten some bad strokes in life at times, why this again? So it raises that classic old kind of why question. Aging, disability, death, pandemic, none of those are seen to be blessings in our culture. You know, they're all seen to be kind of curses. By the way, you should be able to get all this PowerPoint from Leo and the ARC. It's quite fine. I think they're going to put it up. But I think this isolation is also, the kind of enforced isolation or voluntary is kicking up lots of loneliness, fear, uncertainty about the future, what's going to happen. And what gets really, really highlighted these days, which I think is what end of life and loss and grief issues do, is the importance of relationships. not, plans on paper, not programs, but relationships. And those are so key to people's quality of life. And oops, Carrie, I just did something. I'm going to ask you to keep on, okay, thanks. And then with regular grief and loss, it's tough, really tough these days to process grief and loss when you can't be with somebody personally, talking over the phone or Zoom or video, or like last week when not a joyful time, we had to celebrate our grandson's birthday from 10 feet away from the sidewalk to the front porch, so there are no hugs or things like that. So that's tough. Again, the fears of hospitalization. And then people who are working in residential facilities or people who, in those kinds of arenas, there are so many staff from so many different cultural backgrounds. And the ways people process grief and loss really depends a lot on culture and kind of attitudes and assumptions we make with that. And then, of course, kind of the common stigma and stereotypes about people with intellectual and developmental disabilities, and can they feel grief and loss, or can they understand? Some of those stereotypes get, or would they understand if we told them what's going on? Some of those stereotypes get really ramped up, I think, in times of crisis like this. Next slide, please. This one came from the World Health Organization about some of the particular risk of people with disabilities these days. They have hard time getting to access hygiene facilities sometimes. And lots of people need to touch things. A lot of communication is with touch. We know lots of relationships we have with people, everybody, but also sometimes particularly so with people with intellectual and developmental disabilities and staff who need to do touching in terms of their caregiving. That is a kind of heightened awareness these days. It's hard to enact social distancing when you're doing that kind of caregiving. And it's also hard to access information, especially that pertain to individual situations, although we're going to show you some links later on to some bunch of great materials that have been produced in simple English and symbols and other kinds of formats for people with disabilities. Next slide, please. There was a great article in the paper on Saturday, maybe yesterday, it might have been Saturday, in the Waco Trib. We lived in Waco for a while before we came to Austin, and I started doing some op-eds for them and still do occasionally, but there was one that really stuck out at me with talking about what's changed. And Michael Atlas had this great quote, and if you notice the famous picture with nobody in that park and the woman with a mask over her face, the person said, "I make the claim that grief needs love to have a soft place to land. And to do that, we need rituals that heal, that sustain and heal. We cannot run from grief, hide it, or deny it. We can only find and embrace small and sustainable acts of love that unite us." That what caught me was that sense of fear and grief and uncertainty. All of that needs a safe place to land these days, whether it's by parents, whether it's by staff, whether it's the fear of administrators worrying about things that will happen to their programs, whether staff who are worried about their own families. I mean, I think this is a time that calls for all of us to be particularly aware to enabling those kinds of fears and worries to have a soft place to land. Next slide. And we get caught up in paradoxes in our own roles as caregivers. Are you staff to somebody? Are you family? Are you a friend? Again, the heightening of a relationship. Lots of staff will say, "Oh, I'm the friend or family of somebody." Well, no, but they also have other relationships, but we really recognize in any kind of grief and loss, the importance of relationships. A 1, 2, 3, 4 kind of step program just doesn't do it with loss and grief. You've got to be present to people where they are. And we have to learn to kind of be with people as well as do something for them. With any kind of grief and loss, what I say and what clergy have to often learn is just be with people. Don't try to do things, all kinds of things at once. There'll be things you can do. But first is to be present with people in the depth of their feelings and not run from them by maybe trying to provide too quick answers or too quick solutions. We need to keep people safe and protected, but we also need to give people who we love and work with their own choices and ask for their ideas. So as people are stuck at home, think about their multiple kinds of ways people could express preference about meals, about activities, about when we do what. I mean, lots of typical families are having to do the same thing these days. And part of what I've seen about some strategies for families of all kinds is work together on a schedule and let everybody have input and let everybody have, participate in that and feel like that they have some say in this small community of family in whatever way that is. We also are caring for needs of people, but we also want to celebrate their gifts and interests. So as people are stuck at home, I think it's a really good time to say, okay, what are the kinds of things people are most interested in? And how can we find ways to get them some ways to express that or feel that with other people? We often also, as an agencies and people and disabilities, often say, come to us and we can help you with specialized supports. But in times of grief and loss, we need to be able to give away what we know to other people and skills and feelings so that other people feel like they are also able to be in friendship and relationship with people with disabilities and their families. And my best definition of a professional that I know these days is we are people who should know what we don't know and use that to invite other people in who can help us, who might be able to help us with those very things. All right, next slide. So it's also an opportunity. Maybe this is crisis. Somebody moving towards an end of life is partly decline, but it's also a journey. How can we help this to be as self-determined as possible for people? What's really important to them right now? It's that not just what's important for you question out of essential lifestyle planning, but what's important to you. What would you like? How can we help what's important to you right now? And how can we help meet that? This is a certain time to teach people about those teachable moments about grief and loss and planning for the future. And you see lots of articles in the mainstream press about many families and people and couples and healthcare professionals are suddenly having to say, we've got to have a plan for the future. We need to know what our kind of preferences are in case something happens to one of us. And I think this is a time that really pushes that for lots of us, for families in terms of doing future planning. The National ARC has done a lot of good work on that. And there's also a bunch of good resources on end-of-life planning for people with intellectual and developmental disabilities and people being able to kind of write and help develop their own plan. And how do we then now build new networks of care and support for people who maybe cross our lives in this time of crisis or to whom we invite? Next slide. One of the ways we kind of help maintain faith and hope and love is help people prepare. You all have all been had to help the people that you love and people with disabilities prepare on a day-to-day basis for what may happen or what might not happen. Helping people think ahead. This happened. I've come back to a couple of really good resources around that. But for people who are stuck at home, how do we develop some rituals to days and times to recognize that fear and loss and grief? Maybe there's a time during the day you set aside to say, if we're scared, let's talk about how we're scared. And so we don't have to act it out in different kinds of ways if we're really worried about something. So don't deny it. There's a great grief theologian who's Granger Westberg, who said grief denied is grief delayed and grief delayed is grief denied. So you've got to welcome it. And then how do we honor practices of spirituality? I don't know some of the residential programs, how that's done locally at a program, but are there ways to help honor the traditions or cultural or religious traditions of people who were there, even by trying to help make connections, in fact, with faith communities on the outside at this point who could maybe send cards or gifts or do something that would help people to have a sense of connection. Next slide. And one of the things we do, I think, these days, especially when people are worried about relationships, is, what relationships have people had? Have we had? Has your son and daughter had? What are the relationships that have been part of their lives? And how can we, maybe even during this time, reconnect with them? Maybe there are ways to get in touch by phone with a former staff person who somebody really liked, or things that who's been important to somebody over their lives. Can we remind relatives and people out in the community, or maybe administrative staff who clients know and like, to send notes or send a picture or get on FaceTime with? I heard about one group of agencies where all the group homes made a scrapbook of all the people who've been through that home and staff and their activities as a way of helping to remember those relationships and those connections. Because it's those kinds of connections that keep us grounded and keep us from feeling like we're not alone in these times. Next slide. And of course, there are lots of moments if people are watching TV or somebody we know gets sick. These are moments where we need to be able to answer any questions that people have. It doesn't mean you have to run in with a full course on grief and loss and death, but be open to any question that somebody has or any kind of fear, and meet them where they are. And if you don't have people in your agency or people that you know in the community, like clergy or others, perhaps connect with the local hospice or people within the agency who could be willing to talk to people by phone, who may be able to help people kind of think through some of those questions and answers. And if direct care staff are not sure what to say, make sure that they have somebody in your agency or community whom they could call and share with that and say, what could we do here? And address and honor people's spirituality. One of the things that I recommended it's not mine, but a social worker whose name you'll see later talked about when families come into care and support, doing a loss assessment to say, how do families and from particular cultures and faith backgrounds, how do you handle losses in your lives? So we who care and work with them can also know what kinds of things are important in somebody's life and what we will pledge to do or try to do with people in the future, or with your son and daughter if they are in our care. So kind of honoring the different cultural backgrounds and religious backgrounds. Next slide. Next slide, please. So some of the key strategies for dealing with loss and grief at any point are recognize it and welcome it. Don't try to run from it or hide it. It's part of what it means to be human. I sometimes think people with intellectual and developmental disabilities are a whole lot more comfortable with grief than we are with their grief, and sometimes with our own, and a sense of loss, because they will say often what they think. Create a safe place for it, a time where things can be talked about it. Be aware for behavioral expressions for people feeling frustrated or angry or very, very sad, or other kinds of ways, and then assist in all of what we call, or the culturally appropriate ways of acting out our grief. Sending cards, looking at pictures, writing letters, talking about feelings and memories. I mean, all those kinds of simple acts that we do with anybody in times of grief and loss, those are ways of acting out in a positive way some of the kinds of things that we are feeling. Next slide. And for all of us as staff or family, make sure we give honest information to people. Don't try to run from it. Be careful with people with autism that you don't use euphemisms. I often have been told by people with autism, like if we say somebody's friend passed away, well, what does that mean? Or they went to sleep. Well, if that means they went to sleep and I never see them again, I don't want to go to sleep either. So be careful with, kind of things that are euphemisms that can be taken literally. And as much as possible, enable people to be involved in the social and spiritual activities around grief and loss. Again, keep connected to the people with key supportive relationships. I would often say to staff in New Jersey, so if someone has died or a family member has died of somebody you support, who are the staff people who are closest to that person? That may be the person you need to most work with. You don't necessarily need to bring in a clergyman who doesn't know somebody or somebody else or a counselor, but who are the people that know somebody most closely? Who would you turn to in times of help and for support? And how do we then support those people? So I think one of the mandates of this time in particular is how do all of administrative staff and clinical staff and all kinds of agencies support the people who are doing the direct care support and make sure that they feel like they've got a soft place to land, so to speak, with all of their questions and concerns and fears. And just maximize opportunities for the expression of grief and condolences. We've got to help people get that out. And those are Jeff Kaufman, it's an older book, but it's a really good book. And he's the one who talked about loss assessments. Next slide, please. So I want to share with you a couple of recent webinars and websites, and you can get these links by getting the PowerPoint. Leo mentioned one that we did last week through the collaborative on trying to explore some ways that different faith communities have responded with resources to people with intellectual and developmental disabilities and their families. And we had presenters, a Roman Catholic woman who's from the UK in Rome, who talked about a website that they've used to try to create a space, what they call literally a space. She calls it a space, kind of a sacred space for people to visit online with reflections. We had Shelley Christensen, who's one of the national Jewish leaders and supports for people with disabilities and their families, share a number of ways that JCCs and Jewish federations and synagogues around the country have been doing really creative things. Like taking all social groups online and doing all kinds of other things to help people. And then the next couple of slides are from the Christian Horizons up in Canada. So I'm not going to reinvent what they've done. And let me share a couple of slides that they shared. They've taken upon themselves, they've got a great part of their website around COVID-19 resources. Next slide, please. Next slide, please. Oh, there should be a picture there. Nope, go back up. That's towards the end. Skipped a bunch of slides. Keep going back, back. There you go. There's the website that they've got some resources on grief and loss on their site. They've also got several kinds of short videos that they're doing with showing how adults who are in their support and care in their residential programs, what they're doing to cope with COVID-19 and some positive messages. Next slide, please. And they've looked around all over the web and gathered together plain language resources for people with intellectual and developmental disabilities and their caregivers around coping with COVID-19, plain language guides, one-page guides, what's happening. There's a video mentioned here, COVID introduction video, And then there's a resource that are mentioned here that I've also got a direct link for a group in the UK who's got these fabulous resources called Books Beyond Words, which are adult picture books with a text you can use, but mostly meant to sit with somebody else and talk through the pictures and the process. And they've got 3 related to COVID-19 that are up for free on their website, which you can download and use if you'd like. So these are some of, again, those are available on the Christian Horizons website. Next slide, please. And then the same day, last Wednesday, there was an AUCD webinar led by family members and caregivers dealing with COVID-19. I don't think this one is archived yet, but it should be soon. Next slide. But they talked about taking advantage about some of the things that are available right now. And what you see are pictures in this thing of going from the left are some guidelines for families whose son or daughter are needing to go to the hospital about what they can do in terms of helping staff, and others with all kinds of more formal kinds of procedures or requests for a person with intellectual or disability in the hospital. If you don't know my healthcare passport, this is like a person-centered 4-page plan that's very simple, that gives people, direct caregivers in hospitals, basic information about somebody, about what they like, who they are, their personality, and so on. And the whole idea is that would go with and stay next on the hospital table next to somebody's bed to help nurses or others who might be not knowing who this person is, and if there's not a staff person or family member who's able to be present. And then there are great planning resources from the life course planning resource people about future planning and life course resources. Next slide. And these are the links for some of those. The healthcare passport, the preparing individuals for developmental disabilities for medical treatment, those kind of guidelines. The UK, the UMC, the life course materials, and then they've got a day in our shoes, free printable visual schedules for home and daily routines, which I thought sounded really nice. Next slide. And the families who were leading this, who many of them worked for USIS, at the end, one person said, this is not my words. These are recognize what's in your control and what isn't. Focus on how you can turn this prevention from a crisis into an opportunity for growth within the agency, within a family, within the community. Think about what you'd like to do differently in the future. And I added a sentence, what part of that can you begin to do now? The important things that you see we overlook on a day-to-day basis, how can we make sure we pay attention to those important but often untalked about things? Having a plan in a group or in a family can create a sense of some control and reduce stress. And if you can, have a care plan for everybody, but at least have one for the most vulnerable family members and for also the caregivers, whether they be staff or parents and families. Next slide. Other resources, particularly to COVID, and some related to COVID-19. On the bottom, you see the Books Beyond Words. The ARC of Massachusetts now has several page resources on grief and loss and end-of-life planning for people with intellectual and developmental disabilities and their caregivers and families. It's one of my obsessive compulsive try to keep up with the resources out there list. And you can get it from Leo, or you can email me and I'll send it to you. And then the Hospice Foundation has got 3 good webinars, 3 pieces also free on their website about coping with grief and loss in these days of COVID-19. Next slide. And there's a favorite poet of mine who captures, I think, what we're feeling in this time. Don't try to read I'll have the words on the next slide, but if you don't know him, Michael Leunig is a wonderful resource in Australia who's got great poetry, and you can look him up online, but this is a poem called The Tiny Boat, which he wrote when he was in the middle of depression. And you can see the sense of this individual floating in this alone in the sky and universe. And the next slide, the poem goes, God bless this tiny little boat and me who travels in it. It floats and floats for years and years and sinks within a minute. And so the soul on which we sail, unknown by years of thinking, is deeply felt and understood the minute that it's sinking. I think the sense of when some things begin to sink, the usual boats that we are in are the kind of ways that something has suddenly happened in our lives, we suddenly recognize, I think, with some real clarity, what's most important and what are the matters of the soul that we need to pay attention to, whether in families or in homes or with staff, and in caring for and supporting with each other. And that's been one of my mantras. I had a period of depression a number of years ago, and that became one of mine. This became one of my own mantras. And next slide. I think that's the end of my slides. So, Carrie, are there questions that you wanted to make sure we tried to deal with? I guess the AUCD webinar is already archived. The links, some of these links are being put into the chat right now. Crucial that I think at the group home level that people be alert to any kinds of questions. I mean, I think pretending that something's not going, the key thing I think in group homes and in families, if you don't talk about what people are feeling, they're going to feel it anyway. That, you know, we communicate, most of what we communicate is not verbal. And if we don't talk about it, then people who we care for are going to pick it up from us. So so that's one of the reasons that sometimes these hard discussions and topics need to be dealt with. Otherwise,
Yeah,
I think, go ahead.
Yep. Yeah. So, yeah, and I think you offered some wonderful resources in the slides that people, I just want to remind everyone that everybody will get a copy of the presentation today. And so Alex was wondering, can the links to the resources be put into the chat so we can opt and access them? Yeah, so Alex, we will have them, you will be getting a copy of the PowerPoint, so no problem. You can do the links.
And the links are embedded. Yeah, the links are embedded in the PowerPoint. So yeah.
So Beth was saying that resources on autism, COVID-19, and bereavement on the website of the NLM, Nancy Laurie Marks Foundation. So Beth also shared that link. Thank you, Beth. How about anybody else?
Beth and the foundation are starting on a project to create some grief and loss and end-of-life resources for people on the spectrum and their families and caregivers and clergy. It's not anywhere near, it's just beginning to get started in the next year or so, but I'm really excited that they're getting interested. And if you're interested in kind of hearing a little bit more from me about spirituality, I had a great time in Boston in November and did what's called the Pine Lecture at Boston College, and it's archived. It's up on the Boston School of Theology and Ministry on their website, the PYNE Lecture, which is an annual lecture that's done at that school named after someone who, a faculty member who worked in the area of disability, an annual lecture on ministries and theology and faith issues related to people with intellectual and developmental disabilities.
Can I jump in? Can I jump in?
Sure. Hi, Evelyn.
Hi. I wanted to say thank you, Bill, because I think in my experience, which is limited but real, to get to feel comfortable talking about this is the first step. And you've made it, you've taken me along my journey of talking about it with people. And I really appreciate it. It's always hard to know when you're going to come into this, whether you'll end up walking out feeling better at the end or not. So I really appreciate it. I love the resources, but I mostly feel like I can walk in and talk to my son, who is living with a group of people, and One of them lost his mother, who was
Right.
elderly and had been sick, but a week ago, and seems to get all mixed up with whether that was Ken's mother or something else, and it just to help sort it out as a parent, and then to talk to the house manager as well. I feel better equipped, and I really thank you a lot.
Well, let me just say something about that. I mean, one of the things I heard from somebody else one time said that the things that are most important to us are the things that are hardest to talk about. So nobody gets it right, so to speak, in talking about some of these things like this. And the best, like I said, the best thing to do is to say, is to be there and to say, just tell me how you're feeling, or tell me about your mom, or tell me about somebody, and let the kind of doors open up, and they'll guide you about that. People just need someone to listen and to recognize what they're feeling. There's grief has been handled for thousands of years in communities and relationships. You don't have to be a licensed grief counselor to be able to do that. It's a community that holds us up. It's not necessarily a therapist or a clergyman, although faith communities have often been a place for that as well. Spanish resources. Okay. Somebody asked me about, see that. I know of some. Let me. If you'll send me an email, I can try to dig some of those up, or put you in touch with some of those. And I just put my email there, Allison, for you to send me an email.
Yeah, and I'm thinking, Bill, that if you did gather some resources, if you send them to me, I'd be happy to send them to everybody who was on the call today.
Okay, I don't know about Spanish resources related to with disability. I know of a few. I don't know about Spanish resources related to COVID in particular, but there probably are some, like here in Texas in particular. So I'll take a look.
Great, thank you. How about anybody else? Anybody else have?
I'd like to say something.
Ask?
I'd like to comment on the SABE website. Under the Self-Advocacy Resource and Technical Assistant Grant, SARTAC, there are resources for self-advocates or for anybody that you could pull up in any language.
Cool.
And there are also Zoom conferences twice a week for self-advocates across the nation, which is where I've been getting my materials and also inputting on things, so self-advocates can learn all about everything else that we've been talking about, masks and the virus and themselves.
Yeah, I've known about those Zoom conferences, which I thought were really cool. And there's also another conference that's happening, a Zoom conference happening every week for caregivers or staff of people working with disabilities, kind of a national thing that's being done, and by David Retherow and Mark Friedman. And if anybody's interested, send me an email and I'll pass it on to them so they can get you on their list if you're interested in doing that.
Because we don't want to be left out, and we want to know as much as our caregivers know.
Yep.
Our support people know. We want to know everything about the virus, and it's not being told to us otherwise.
Yeah.
Good
Exactly.
point, Ann. Thank you.
I have a question.
Yeah. Sure.
I'm just wondering, this has been wonderful, this whole video thing. I know others that might be interested in hearing the information that you've given out, as well as my daughter might actually find some comfort. She has a disability in just hearing this all. Will there be a link later that you can actually watch this later after this is over?
Yes. Our office will make sure that it's downloaded and then, uploaded to our YouTube site. So it usually happens towards the end of the week. So be on the lookout, and it will be announced. So yes, so people will be able to access that
on the
and then
YouTube.
Yep, on the ARC of Massachusetts YouTube.
Okay.
And if you go to our COVID-19 pages on the Arc of Massachusetts as well. You'll be able to access these.
Thank you.
All our webinars are recorded. Okay, no problem. And Kathy Service also gave a resource.
I also have a question. Am I coming through audio?
Yes, Kathy, go ahead.
Yeah, it said, do you have resources for the deaf with intellectual disabilities, for caregivers and for the individuals themselves?
Who are deaf.
I have a deaf daughter, but she also has intellectual and developmental disabilities.
I know that there have been some done around people who are deaf. I don't know about deaf and intellectual development disabilities, although those books beyond words, which I think goes back to the question somebody else had a minute ago about what to say. I mean, looking at this kind of storyline, it's essentially a storyboard about facing the COVID-19 thing, and then being able to, assuming somebody can then talk with a person about what's going on in those pictures, might be a really good resource.
Okay, thank you. And thank you for this. It's been marvelous.
All right, so this is Carrie again. Any other questions? We had wait a minute or so. I know we've run over time, but this has been fabulous information, Bill. We thank you for joining us today. And Lucy, would you like to unmute yourself? Lucy Chansky raised her hand. She wants to ask a question. You able to do that, or you'll need some help, Lucy? I can unmute you.
Now I can do it. Okay. Yes,
Okay.
I just noticed on the participants, people have numbers beside them. What does that mean?
Numbers beside them.
When you go to the participant list?
Okay, I'm looking. I don't see any numbers. I'm looking at it right now. I've just looked at my participant list, and it has people's names and whether they're talking through a microphone or a computer,
No?
and whether or not they. Yeah, I do see
I see
before
one
the
number
name.
now. There were some other numbers. Now they're gone. But for instance, next to Elizabeth Wick, I see a number 1.
Yeah, I don't see those. Sorry, I have no idea. Not sure if anybody else is knowledgeable enough about Zoom meetings, but I don't see them anywhere.
I don't see them either.
That's strange because now most of them are gone. But I'm just curious
Okay.
to know. It has nothing to do with the presentation, which was excellent, and thank you. But I'm just
Okay.
curious.
Yeah, I am too. I'll find out about that. I've never heard of that before. I've never seen any numbers before.
Either.
So
Thank you.
Actually,
Okay.
before you go, this is Jossie.
hi,
Hi.
Jossie.
Hi. Before you go, I actually I wanted to put in the chat a visual communication tool that is from the Massachusetts Public Health's website. I want to put that in the chat for people. The person who asked about hard of hearing, also with intellectual disability. I'm going to paste that in the chat right now. That link. Hold on.
Perfect.
I just
Thank
did.
you so much.
That's
Okay, thanks,
That's a
Jossie.
visual communication tool from the Massachusetts Department of Education.
Cool.
Okay. And then Beth just answered our question about the numbers. That's the number of people on the call, she said so.
Okay, so does that mean that those people had 3 people listening?
Again, good question.
It might have been the
I think it started out with 43 people on the call, and now it's down to 34 as people have peeled off. I think it is. So that's
Okay, that's what it is.
I don't
Alrighty.
know. I don't see it individually, but next to the chat sign, I see participants, and it's going down as the time is marching on.
lunchtime, past lunchtime for you guys.
All right. Okay. Well, I think so. That's all for today. Thank you so much, Bill. Appreciated your inspiration, your words of wisdom, and
My honor.
I think all of us are going to take this a step further so that we can help others heal. So
Thanks for the work you're all doing.
okay. You take care.
Bye
Bye-bye, everybody.
Bye.